It is my pleasure now to introduce Professor Saridogan, which is a professor of gynecological surgery at University College London, and my boss at the moment. He is the former president of the British Society of Gynaecological Endoscopy and is the present president-elect of the European Society of Gynaecological Endoscopy. So please, Ertan, the floor is yours to talk about not sure if this malformation affects the results.
Thank you, Maribel. Thanks for that kind introduction. And I, too, would like to congratulate Attilio, Luis, and Sergio for this new format meeting. I think it's worked very well by challenging each other from different groups instead of actually satisfying ourselves with internal dogmas that we have within these surgery group or ultrasound group. So scientific level has been very high. So this title was given to me. I didn't choose it, but I'm going to do my best to cover why actually it says in the title. So I'll start with a case that I was involved. Actually, not long ago, a few years ago, my former flatmate from Istanbul actually sent me a message. Can I ask your opinion, please? My niece has been advised to have surgery to correct the shape of her uterus. She was told that she had an abnormality that prevented her from having children. And then he enclosed the ESGE photos. And as you can see, the uterus doesn't look quite right. The fallopian tubes are open, patent on both sides. So according to the previous Kahoot survey, I think many of you elected to say that we should operate on these patients only in selected scenarios. And then there was about 25–30% who said they would always operate on this. So obviously, I didn't just say, yes, she should go ahead and have operations. So I asked for more questions. I said, how old is she? How long has she been trying? And are there any other abnormal tests? And then he replied saying she is 37, trying for a year, and the only issue that has been detected that the husband's semen analysis showed a morphology of 1%. So, can I just, I don't use Kahoot, but can I ask you if you would operate in this situation or do something different? Who would operate? Just raise hands. Okay, only a small minority. So this was the shape again. So let's go back a little. Maribel obviously highlighted the association with DES and then the original ASRM classification, which described it as DES-related abnormality. But if you go back to the last century, our friend Grigoris Grimbitz has actually published this review. It was the best one at the time, Clinical Implications of Uterine Malformations. And if you look at the implications, that actually there was no place for dysmorphic uterus. There was none. So in the 20th century, we didn't actually have any patients with dysmorphic uterus or any publications. And then just 3 years on, my colleagues in London, they actually looked at a group of women with gynecological problems, but no infertility or recurrent miscarriage. That is the control group versus recurrent miscarriage group. And uterine anomalies were about 1 in 4 in the recurrent miscarriage group and about 5% in the control group. And what were these abnormalities in 2003? Majority were IQ8 that we don't consider abnormal anymore. And the biggest abnormality was subseptate uterus, followed by bicornuate, unicornuate, and then none with dysmorphic uterus, 2003. So let's just move on. 2011, another publication from the UK, Nottingham Derby Group, Kanajaya Prakasan and Nick Rain Fanning, that I'm sure you recognize the names, who are ultrasound experts. And out of 1,385 women with infertility, they found only one dysmorphic or T-shaped uterus. And then again, the majority of the abnormalities were arcuate uterus, followed by septate uterus. So in a way that by 2011, we didn't actually have kind of evidence that dysmorphic uterus was a real entity. Then come to today, that we actually just in the last month, in the last issue of X-Views and Vision that I edit, we published this article from the Spanish Fertility Society, which included obviously Luis and also Tony, who is sitting there. And they looked at impact of various type uterine anomalies, including dysmorphic uterus that you can see here at the bottom. And then I actually magnified that you can see here. They said it increased the first or second trimester miscarriage by 5 times. The odds ratio was 5.2. So the review was for dysmorphic uterus, but then in the text they refer to T-shaped uterus, and they use it interchangeably. And then I'm going to explain why that is significant again. So according to their review, just this year, it is significant. It is present, and it is significant. So I'm going to actually going to dissect the data from these 2 studies that they included to see what we are talking about. This doesn't seem to move. Let's try once more. Okay, so this is the first one. It's from Romania. They obviously included U1A, U1B, U1C, and kind of they described U1C as generally dysmorphic uterus without giving any other details. And then they had about 690, let's say 700 patients with infertility. 590 of them, 86 of them had a normal uterus. But if you look at the, so that's the normal uterus. If you look at the dysmorphic uterus, it is by far the biggest group amongst uterine abnormalities. So from being none, then in 2020, we came to dysmorphic uterus being the widest group amongst uterine abnormalities. And then if you look at the further details, that it's not T-shaped, it's not hypoplastic infantile uterus, but it's the other dysmorphic uterus, which has no obvious definition of what it is. So we don't actually know where they found, out of 690 patients, that 35 patients with a dysmorphic uterus, majority of which were not well-defined type of dysmorphism. And then the second one, so that was the first paper, and then they again, going back to this, that some of these patients with dysmorphic uterus actually had IVF, as you can see here. 18 of them had IVF, 14 became pregnant, 77% getting pregnant, and the miscarriage rate was 21%, significantly higher than the normal uterus group. So this data was included, 14 patients with 3 miscarriage in the meta-analysis from the Spanish fertility group, Luis. So the second one is from Armenia. And then the numbers are about 400 patients. 266 were found to have normal uterus. Again, look at the abnormalities. T-shaped, 27 of them out of 400 had T-shaped uterus. And then 73 had so-called intermediate dysmorphic uterus. And then the rest were described other anomalies like subseptate uterus. Kind of, I think this is an issue, this is a problem, that all started finding, or at least some groups started finding, so many dysmorphic uteruses with no well-defined criteria. They obviously put some photos to describe, but they found that the chance of getting pregnant was not different, biochemical pregnancy, although the clinical pregnancy rate was slightly different, slightly lower in the other anomaly group compared to the normal uterus group. With the T-shaped uterus, the clinical pregnancy rates were similar to normal group. So that's clinical pregnancy rate. And okay, and then these were the examples that they gave. So, okay, this is a convincingly T-shaped uterus that I would accept, but what is this? I don't know. Is this a normal uterus or dysmorphic uterus? It's difficult to say, but that was the best example that they could put in the paper. And they looked at the pregnancy outcomes. As you can see, the description of T-shaped intermediate, they all had higher preterm deliveries, miscarriage rates, and even ectopic pregnancy compared to normal groups. And then that was the case for other abnormalities as well. So here the issue is that if we go back to that, this one, the review actually included the miscarriage rates from the total group, not from the numbers became pregnant. For this Armenian paper, for the Romanian paper, they included miscarriages based on number of pregnant women. So again, there was a major issue there that they put them together to find 5 times increased miscarriage rate. So this has been shown, and then Tony, I think, is going to cover this in more detail. But I just want to make a point about this systematic review as well, why I have the opportunity. So you'll hear that this improves the pregnancy rates, reduces miscarriage rates. But the numbers, more than half of the patients included in this systematic review is from that paper. I can pronounce it. It's from Turkey, Haydar Dedeoğlu. 270 women with T-shaped uterus came from that. It's more than half of the entire systematic review. And the diagnosis was made by ESGE, no ultrasound. Where do you find 270 women from with T-shaped uterus? I don't know. Okay, so that what happened to my friend's niece? I actually said, after seeing the high abnormal semen, I said, try IVF ICSI once, and at least once, and then if she doesn't get pregnant, have surgery. She did try ICSI, and then she was pregnant in the first attempt and had a cesarean delivery at term, not even premature. So in a way that I think we can conclude that we shouldn't really be sure on the results of this malformation on reproductive outcomes, especially based on the published data as I've demonstrated here. The published literature is far from convincing. Well, thank you for listening, and I would like to invite you all to our next Congress in Marseille at the end of October. Thank you very much.